Well, hello, members. I'm Dave Siegel. I'm Executive Director of Housing First Minnesota. And as a critical industry during this COVID-19 crisis, we want to make sure we follow CDC guidelines, Minnesota Department of Health guidelines, and we want to ensure worker safety. So to help us consider some strategies and tactics to make sure that our team stays safe, we brought together two safety experts to share their perspectives. I do want to mention at the close of this, there'll be a slide. If you have specific questions we didn't get to or some thoughts that you want to share, some information that we didn't provide for you, then that information, that email address will be at the end of the slide. Give you a little bit of information now briefly about our two presenters. Denise Hansen has been Safety Director for John Kraemer Sons, custom builder for the past 6.5 years. Very knowledgeable in OSHA compliance, risk management. Bill is Occupational Safety Specialist for the Minnesota Safety Council. He has more than 15 years of experience in workplace safety and loss prevention, and knowledgeable in safety, hazardous waste management, occupational health, and even workers' compensation. So thank you both for being here. We welcome you both. Appreciate your knowledge and information. So let's just start. Bill, we'll start with you. What broad steps should employers and owners do at construction job sites?
Well, I think the biggest thing that people can do is to make sure that everyone knows what the symptoms of the virus are and communicate those symptoms through verbal communication, through posters, through handouts, just making sure that people know and understand what those symptoms are. The next big piece, I believe, is to develop a COVID-19 exposure control plan, which includes zero tolerance for people that are sick, or showing symptoms of the virus. When people come to the workplace in a not well state, regardless of the illness that they have, they're potentially spreading this illness to others. And especially now during this crucial period of time, if people are sick, they have to stay away from the work site. The next big piece, I believe, is to communicate that plan effectively, not only with employers, but also the subcontractors that are coming onto the job site. Because, one organization may have a plan where another organization may not have as much coordination or awareness. And so that plan needs to be communicated effectively through all ranks of people that are coming onto a particular job site. The last piece, I believe, is to enforce the plan. Plans are good, but unless you physically enforce that plan, you're not going to have any success in keeping ill people away from the job site.
So Denise and Bill both, what are then some actionable steps that you have seen companies taking? Maybe Denise, will start with you and then Bill can add in a little bit.
Yeah, well, I think you really have to put a lot of the responsibility on the job supervisors that are out at the job and seeing the subcontractors and the employees coming onto the job site. And a lot of the guys on the job sites have developed relationships with each other. And so they are not going to want to get their coworkers sick that's going to then carry it home. So I think developing that responsibility to your coworkers is a very important part.
And Bill, similarly, kind of some specific things you've seen companies doing or action steps they've been taking?
Well, there's a lot that's going on. Initially, reducing crew size, contractors focusing on critical activities, deferring non-essential activities, a daily crew health assessment, which includes not only the workers, but any visitors or new employees coming onto the job site for each shift. There's a lot of examples available for companies to use, so I don't need to go through the basic steps, but there's probably 3 or 4 questions that people ask regarding, the state of well-being of any individual. And so, CDC has guidelines appropriate for that piece. And so ultimately you need to, begin that daily crew health assessment and kind of stick to that regime. increasing personal space to a minimum of 6 feet wherever possible, limiting access to the job site, and specifically the work trailer. You don't want to be congregating in groups that are larger than, say, 10, for example. In a job site trailer, it's pretty hard to maintain a 6-foot distance. So we're seeing a lot of job site superintendents restricting access to maybe 1 or 2 crucial individuals within that trailer.
Right.
Also,
I've also heard, Bill, about, just people, and Denise, people coming to the job site uniquely in their own vehicles, where perhaps they used to carpool a little bit, and a strong suggestion to come to the job site individually, for example.
Yeah, no, that's excellent. Many companies are now prohibiting carpooling just for that purpose alone. And then continuing down that avenue of minimizing interaction between work teams, you don't want to stack the trades one on top of another. If you've got electricians, plumbers, drywallers, all of the different trades, they can have their own space. And as you appropriately distribute those individuals throughout the work site, you'll have that opportunity to really socially distance them. Another huge piece that we'll talk about in just a little bit is keeping the job site clean, and we'll touch on sanitizing. But ultimately, employers are dedicating people to the cleaning process, and so you may have a team or a crew, or maybe even a single individual, that their sole responsibility on the job site is to sanitize spaces that may be surfaces that may be frequently touched.
I know, Bill, on our website, and then Denise, you maybe are doing this too, we do have a link to a job site poster. I think it says 1 trade per room, something like that. I think, to your point about keeping that social distancing, not stacking up the trades, it's kind of nice, I think, in residential construction. It lends itself to being able to socially distance. I think, Denise, you'd say that's probably true, would you not?
Oh, absolutely. And to make sure that the job site supervisors know that the control and those scheduling of those workers, they have the authority to do that, to help manage and make sure that we don't end up with too many trades on site.
So maybe a little bit diving in a little bit more specifically, what about, Denise, shared tools? Obviously, probably discouraging that. I would assume most employers now, most construction companies now, are saying use your own and so on. What do you find?
And that comes right back with Bill and your morning plan to figure out exactly who's going to be doing what. If you can break those tasks down, so you have just one person doing the cutting on the table saw, mm-hmm. and arranging it so that we don't have guys all rushing for the same saw. And yeah, definitely using your own tools and providing hand sanitizer in those areas where those things do need to be shared. So it's a quick and easy task to clean that off.
Are you finding, and I don't know if this is helpful at all, are gloves being used at all or not being used? What are you seeing there? Would disposable gloves being helpful at all or not?
Oh, absolutely. Disposable gloves are definitely going to be, especially for people who are doing the disinfecting and cleaning. We need to be sure we've got those things supplied for them out there. And yeah. Okay,
and Bill, I think similarly to tools, and you may want to add to that, but things like, your portable toilets. I was at the dog park the other day walking my dog, and lo and behold, the portable toilet is closed. So what do we do on a job site? How does that work?
All right. Well, I'll back up first and talk a little bit about what not to share. Tools, personal protective equipment, electronic devices, any hand towels, food or lunches, water cooler, water bottles, you want to stay away from that. Toilets are required. They're mandated on every job site based on the number of people that are present. And so, you know, in addition to the daily cleaning that you might have with the cleaning crew that I had mentioned earlier, most organizations are going to twice a week cleaning by the company that they're renting the portable toilet from. So, you know, we're seeing a little bit of increase in the, you know, the cleanliness of these, and then the daily, you know, cleaning, that the areas that are being touched predominantly, you know, which would be the handles, both on the inside and outside. You know, those should be managed on a, you know, daily basis, and possibly, you know, more frequently than just once per day. So, you know, it depends on the size of the crew and the number of people that are putting these things into service.
Yes, yes. And
Especially
again,
those handles.
I'm sorry, go ahead, Denise, go ahead.
Especially those handles. You want to be sure the handles on the inside and outside are cleaned frequently.
And then similarly, you know, we part of the allure of a job site used to be that you'd sit around and have lunch together. I think we're doing that, you know, in a very different way now, are we not?
Well, when the weather is colder, it's a little bit easier to have them have their lunch in their vehicles. But discussing with them in advance, where they're either going to have their lunch in their vehicles or find an area where they can maintain that distance. I think the other important part of that is to be sure that they're not leaving their water bottles, pop cans, eating utensils on the job site.
Yeah.
You leave it there, you leave it laying around, and somebody else will have to come and clean it up. So.
Okay, great. Right. Bill, I think maybe we mentioned this, but it's so important, and we have the general contractor, we have the trade partners, and just how do we impress upon everybody that's on that site the need for safety, the importance in COVID-19, because it is really critical that we maintain this designation, and we really don't want anybody to get sick. So what are you seeing companies do?
Well, you know, the onus of responsibility needs to be pushed down to each individual. You know, we think about safety as everybody's responsibility. Here's another example of that. You know, you have to take some responsibility for yourself. You have to know and understand what steps are necessary to protect yourself. There's certainly some guidance by the CDC on this. There's a handout, there's guidelines for how to protect yourself from, you know, directly from the CDC. So those are communications that are being made. You know, delivering the message to people to practice good personal hygiene. You know, it's not always easy to wash your hands frequently on a job site, nor is it easy to avoid touching your face or your eyes, especially when you've got a lot of, you know, you're sweating, you've got glasses on, you've got dust flying all over the place. So that portion of you know, thought process really needs to be driven to the individual themselves. Specifically when it comes to, you know, and I was on a job site yesterday where somebody was sneezing. Okay, well, hey, it's allergy season. The dust that from the work, I mean, these guys were roofing, and you know, you can imagine the amount of dust that's involved in ripping shingles and tiles off of a roof. So sneezing isn't necessarily transmitting disease, but at the same token, you know, how do you do this? You know, you cover your mouth, you sneeze into your elbow. You know, there are personal issues that you can take, you know, that really do improve the hygiene process. Even if you're not sick, you may not know that you're transmitting virus if you're asymptomatic. So, you know, sneezing into your elbow is a great example of things that people need to do. And then I think the last piece is to effectively use PPE, the personal protective equipment. We know that this is the last resort in protecting ourselves from hazards. You know, and quite frankly, everyone should know and understand that by wearing a mask, it doesn't protect you from a sick person. But if you're asymptomatic and sneezing and or coughing, these masks certainly go a long ways in protecting those around you. So very, very important to do that. You know, the last piece about, you know, workers on the job site is, you know, be mindful of what you're bringing home with you as well. You know, as you come home, you know, you don't want to be shaking your clothes out. You want to, you know, take your clothes, get them into the washing machine, clean them. You know, I want people to use good personal hygiene, and so that means maybe washing your clothes a little bit more often than you've been doing so in the past. It is important to know that contracting COVID-19 from inanimate objects like clothing and the whatnot is very rare. You know, the possibilities do exist. So, you know, take caution, take precautions, because, you know, your family is who is going to care for you if you do get sick.
Denise, you mentioned the importance of, you know, sort of thinking about this in terms of, as you mentioned, the colleagues that you've developed relationships on the job site and with whom you work. It seems to me like that's a pretty powerful motivator to do some of the things Bill talked about, as well as your own family that you don't want to put at risk, right?
Well, exactly. And I think that's the approach that I like to take when I go out for any of my toolbox meetings or safety meetings with the guys on the job. You know, a lot of times I'll tell them, I'm not here for OSHA, I'm not here for your boss or my boss. I'm here for your mother, and I'm here for your wife. And I can add to that, I'm here today for my son too, because I have a child that would not do well with catching this disease. And so if you can really get these guys to think about the other people on the job site, it's going to be a lot easier. Now, we had somebody, and I was so happy to hear that they are recommending masks. We had somebody that we had make these masks that we're going to be distributing to our guys out on the job sites. And so it's available to them if they want to. Now, we can't tell them that they have to wear these masks, but boy, it sure would be good if they wanted to jump on board and keep their own germs to themselves. That's going to go a long way to prevent spreading their germs onto surfaces and tools. And I think it'll just make a huge difference out on the job site.
Well, I think helpful suggestions, by the way, thank you. And thinking a little bit uniquely about a remodeler's situation, I guess new home construction is certainly one thing. It's generally unoccupied house, obviously, other than the workforce. Denise, are you guys doing some remodeling, and are you doing anything unique and specific about that situation where you are in someone else's home? And of course, they may have some concerns, and the workers may have some concerns.
Yeah, exactly. And what you need to do is you need to sit down and put together a list of things that you can do. Can I block off this area of the house that's being remodeled? Can we put plastic up there? Can we bring air scrubbers with HEPA filters onto the job site and create that positive or negative pressure in those rooms where we are cleaning that air? What kind of PPE would you like to see our guys in? You know, we can guarantee that they've got clean clothes on in the morning, that they've got clean tools. You know, they can put booties on their shoes so that they're not tracking anything in. So I think it's important to develop that list and go over those things with the homeowners and find out exactly what's going to make them comfortable.
Bill, anything that you want to add to that you have seen in other environments that maybe apply as well to that remodeling dynamic?
Well, I think that, you know, we're seeing, just as Denise had mentioned, we're seeing contractors that are, you know, going to that zero contact concept. You know, they're coming with their tools sanitized, they're coming with clean clothes, they're wearing the proper personal protective equipment to, you know, minimize, you know, contracting and or transmitting any potential viruses or other pathogens that might be present as they're doing their work. So You know, it's a great job that most people are out there trying to accomplish right now.
Well, no, and then Bill, just the respirator masks, the N95 masks. I know our industry was asked to supply those to healthcare workers, and so in many cases we did. I imagine most kept enough back for themselves. Are you seeing any challenges there, Denise, as you as well, with available masks?
I was just talking with one contractor who said we have absolutely no difficulty. If people need respiratory protection, they'll have respiratory protection. I do understand, you know, at the national level, there is a shortage, and for those individuals who may be experiencing some difficulties in obtaining N95s, you know, there's some. First and foremost, let's begin with what are my options here. You know, Denise had mentioned a couple of great things, you know, creating negative or positive pressure through either exhaust ventilation or pressurization of a room using HEPA filtration. You know, so using the engineering controls that are available. You know, there are other methods to keeping dust down. You know, you can use floor dry and whatnot to, you know, avoid creating respirable particulates. You know, this is where the N95 is effective. You know, as I had stated earlier, the N95 respiratory protection as a filtering facepiece respirator does not protect you against any virus. You know, I mean, it's to protect the general public from you. So, you know, when you think about N95s and hey, you know, they could be in short supply. Now, here's the cool thing is that, you know, well, another thing that I didn't mention is the administrative opportunities. You can control exposure by rotating workers. So nobody has to be exposed to high levels of respiratory issues over the course of a day if you use an administrative control like rotating workers. You know, the real key is to keeping that exposure level below the permissible exposure level over an 8-hour time-weighted average. So, you know, you can breathe some dust, but if it's a short period of time during the day, it's not going to exceed that PEL as long as you're not also exceeding any known exposure limit. You know, so you don't want to be exposed to too much dust. And now I'm talking about just plain old respirable dust, not the, you know, regulated pieces like asbestos, lead, and silica, which, you know, those are mandated respiratory protection unless you're using some other forms of controls, which include, you know, for silica, you know, the use of table 1 out of the respiratory protection standard. So, or out of the silica standard for construction industry. Now with PPE, the cool thing that I was going to mention is that OSHA has just recently, and I'm thinking last Friday, come out with new interim enforcement guidance. And, you know, so you can consider extended use and or reuse of N95 filtering facepiece respirators, or, you know, filtering facepiece respirators that have exceeded the recommended shelf life. You know, I think we've heard in national news just recently the numbers of respirators that are showing up from the national stockpiles that have expired. As long as the elasticity of the band is sufficient that people can, you know, tighten this thing and have a fit on their face, I think it's okay to use something that's been, you know, beyond its recommended shelf life. Another thing to understand is that there are other devices available besides N95 respirators. You know, there's the NP and R designations for respirators, and they go all the way up to P100s, which are near HEPA filtration quality respirators. These can be used in place of an N95. Yep. You know, PAPRs, or the powered air purifying respirators, another excellent way to provide respiratory protection to individuals. There are half mask respirators, the polymeric half masks with cartridge filters. You know, people just need to be aware of the fact that there's more out there than just an N95. So if you have issues and needs, address them. You need to be sure, however, that if you change respirators, even from an N95 to a P100 in a filtering face piece respirator, you have to go through the fit testing process. That's a step that cannot be missed.
What do you think is the most challenging aspect? And part of it for me is that aspect that this is not going to go away. And obviously we believe at some point we're going to have a vaccine. So I do think that is one of the challenging things, is that this is not sort of, oh, we're done with this and now we can forget about it. Other pieces about this that are challenging for either of you in terms of what you're seeing on the job site, just kind of broadly?
You know, in the construction trades, it's constantly a challenge to have workers and qualified workers. And so you understand clearly the importance of human capital in these situations. When a good person is gone and they're gone for, you know, weeks at a time, it's going to impact your operation. And so, you know, a little bit of care up front is really going to go a long ways in making sure that you maintain the quality of the organization that you desire to have.
Anything else that you, in your expertise and experience, they want to share with the construction industry? Don't forget about this, even as you're thinking about COVID-19. Maybe Denise, we'll start with you, and then Bill.
Well, we still do weekly toolbox training out on our job sites. And this is just going to become an additional component, even if it's just a reminder at the end of our regular toolbox meeting on social distancing. I think, yeah, we absolutely can't forget about safety in all the other areas. But yeah, I think, you know, we're going to continue. Things are going to change as far as how we present our toolbox meetings. Everybody gets in a circle. We have everybody sign in on the same sheet, and those things are going to change. So, you know, we won't be having sign-in sheets anymore where everybody's holding the same paper and pen.
Yeah. But I'm thinking about things like, you know, be sure you tie down if you're on a roof or something. Obviously, those are, you know, we know those things, but I think we can't forget about those things.
Absolutely.
Bill, similar thoughts there?
Yeah, I agree with the, you know, the fundamental concepts of, you know, where are our risks and staying on top of the hazards and making sure that people are capable of recognizing hazards and dealing with hazards effectively. You know, Denise pointed out that need for continuous, effective training. You know, it's one thing to run people through training. It's another thing for it to be effective. And part of the process, and I think that, you know, ultimately what this whole crisis mode is going to do for us is to look carefully at the kinds of training that we're providing, and then really looking at the effectiveness of that from the standpoint of, you know, we used to talk about worker right to know, and now that has shifted specifically to workers' right to understand. And you see more and more the concepts of you need to communicate not only in a language, but also a vocabulary that people will understand while you're talking to them.
Well, I really, really appreciate both Denise, you and Bill. Thank you for your time, excellent information. If we didn't get to a topic or a question that the viewership has, please let us know. You see an address there for Tom, who's been behind the scenes running our session. Thank you very much, Tom. We're going to plan to continue these kind of informational webinars and want to be sure they're relevant and valuable to the members. So if you have suggestions, questions, any of those kinds of things, contact Tom. And again, Bill and Denise, thank you so very, very much. We really appreciate it. Thanks again, everybody. Stay safe, stay healthy, and let's follow the practices that Bill and Denise have shared with us today to make sure that, you know, we have the best of the job sites out there. Appreciate everybody's time. Thank you.
Thank you.
Thank you.